Ontario recently ended the 3 paid sick days introduced during the pandemic. It's one of several changes unfolding as the role of COVID-19 in our lives shrinks. But if the situation is no longer as urgent as it once was, have policymakers picked the right changes to keep? Or could we be losing some of the hard-earned public health lessons? Let's ask. In Peterborough, Ontario, Dr. Thomas Pigott, Medical Officer of Health and Chief Executive Officer at Peterborough Public Health. And here in our studio, former Scientific Director of Ontario's COVID-19 Science Advisory Table, Dr. Fahad Razak, who is an internist and epidemiologist at St. Michael's Hospital, and Dr. Monica Dutt, Public Health Specialist, family physician, and a member of the Decent Work and Health Network. Thanks to you all for being with us.
Great to be here.
Thank you. I know your schedules are incredibly busy, so we appreciate your time. I think if, right before we started taping, I said that if you go outside, the weather is beautiful, very few people are masking, and when you think about it, it feels as if we're living post-COVID, but that's not the case. So we're glad to get into the numbers. First of all, let's look at Public Health Ontario's data on COVID-19 and influenza in the province. In the week prior to April 1st, 2,779 cases of COVID-19 were reported. There were 211 hospital admissions, and 30 Ontarians died. As of April 1st, COVID-19 and influenza positivity rates across Ontario are low, both sitting at under 10%. COVID-19 positivity is sitting at 9.3%. Influenza A is at 0.4%, and influenza B is at 1.3%. In the past 6 months, just 18.6% of Ontarians received a booster dose with a COVID-19 vaccine or completed their primary series. Those stats are from the Public Health Agency of Canada as of March 31st. So we went through a bunch of numbers. I wanted to get your perspective from all of you, but Thomas, I'll start with you. Are we repeating public health mistakes when it comes to preventing viral surges?
Well, I want to start by reading you a sentence from a lessons learned report. Long before SARS, evidence of actual and potential harm to the health of Canadians from weaknesses in public health infrastructure had been mounting, but not catalyzed a comprehensive and multi-level government response. Now, that sentence is from the Naylor report nearly 20 years ago after SARS-1. Here, after the most acute phase of SARS-2, we're already rushing to forget, I think, many of the lessons learned and the sustainable need for continued public health and health system readiness for continued waves of COVID, because it's not done. In my small region, 2 people have already died this month in the last couple of weeks from COVID. So it's not completely gone, and it may rear its head again, but also the next pandemic. In my short career already, I've been through about 5 pandemics, none nearly as significant as this, but the one thing that's inevitable is that there will be another. And, as the Chief Medical Officer of Health report this year said, we can't keep having this boom and bust cycle of public health readiness and public health funding. We need a stable response.
Monica?
Yeah, just to echo that, I think we're going to have a similar report. They're already coming out saying we need a robust public health workforce, which was already said 20 years ago. We need data information systems that are strong, which was also said 20 years ago. So I think all of that will be said again. So unfortunately, I think those are some of the lessons that we've had that we haven't learned. And I think also thinking about some of the policy pieces that we did put in place during the pandemic, for example, paid sick days or access to healthcare for people who are uninsured. We are already canceling those programs when those are some of the lessons we should say those are pieces that need to stay in place.
We're going to come back to that in just a moment, but Fahad?
Yeah, I think you've heard what is widely held as a perspective on this. You can't treat the pandemic as completely on or completely off. The world today is different than 2019. We have persistent circulating COVID in the province across the country. Is it the waves we saw earlier with a huge number of people coming in with that respiratory COVID pneumonia? It's not. But are people dying? Are people ending up in hospital? Is it very disruptive to society? It absolutely is. And part of that stable response has to be strengthened public health. So I think, harkening back to the Naylor report, 20 years ago, this was recognized as a deficit in Canada. Right now, public health units are fighting again for funding as we are still very much in the midst of this pandemic.
So you just said something that I think is really interesting. You said that it's still happening. I'm always kind of, I don't know what to say. Like, are we in the pandemic? Are we post-pandemic? Do we continue? Because I'll be very honest with you. I'm one of those Ontarians that hasn't kept up to their vaccines. And I don't know, is it important? Is it not important? So who's at fault here? Is it the public? Because we all went through this together, or is it the messaging that we're receiving?
Yeah, I mean, starting with the data. So 3 years of the pandemic have completed. The third year, 2022, saw more people die than 2020 or 2021. So clearly the data shows that we are at a point where the damage from COVID has not receded. If you look at the number of people in hospital in Ontario or in Canada right now, we have not gone back to the low water mark that we had in 2020 or 2021. So what we are seeing are big surges. It comes down, it never comes back down to that baseline, and then it goes back up again. So we've clearly not, from any data objective review of what has happened, we are not outside of the pandemic period. Now the messaging. So the messaging, I think, has moved. It has moved to societies reopen, get back to normal life. What I'd like to see is adaptive messaging. So has COVID caused the kind of disruption today as it did a year ago, 2 years ago, 2 years ago, 3 years ago? No. Clearly things have improved. We have effective vaccines. That severe pneumonia presentation is no longer happening. But there are still adaptive things you can do today to lessen the damage on society, and especially those who are most vulnerable. So, I said 2022 saw more people die, but it was concentrated among the most vulnerable people from low-income neighborhoods, older individuals. So there are vulnerable members of society who are still very affected. And for all of us, I think it's still very disruptive.
Thomas, I think for a lot of people, when they do hear that more people died in 2022 than any other time during this pandemic, it's a surprising thing to hear. I'll ask you the same question. So do you think are we to blame for the way that we've kind of moved forward? Or is it the messaging that we're receiving that this is something that we're over?
Well, I think it's a combination of factors, and I think to some degree it's natural. When COVID first started, I very much remember the sentiment in January, February, March 2020. We thought we were in for a sprint, and it turns out that it was an ultramarathon, and it's a race that we continue to run. And instead of really modulating to slow and steady, we sprinted and I think became fatigued. We see pandemic fatigue now, and we see sort of a complete abandonment in wanting to move on. I see some of the interventions continuing to be important. If we take indoor air quality improvements, we've learned that COVID-19 is transmitted through primarily an airborne route, and what's really important for those kinds of infections then is improving indoor air quality. I was really happy to see when I did my tax return this year the federal incentive to deduct investments in indoor air quality improvements in businesses, but I think we need more financing, more funding of indoor air quality improvements to have a sustainable response to the pandemic. Other measures, continually staying up to date on vaccine, continue to be important. That's why we are in the good place we're in today, is because of the vaccine. It's been a game changer. I lost a physician colleague, a young physician colleague, early in the pandemic, and that kind of period of fear is something we've quickly forgotten, thanks to the scientific advancement and how good uptake we had of the vaccine in Canada. Had we not had that, we'd still be in the same place. But I think as a result, people kind of look back and start to question some of the decisions and some of the work, but it's been a life-saving in what's been the most significant pandemic in over a century. Over 52,000 Canadians have died, more than who died in World War II. This is a major event, and we need to consolidate some of the lessons learned so we continue to do those things. I don't think we'll be wearing masks indefinitely. I see them more as winter tires that you strap on when risk goes up, and you're really trying to prevent infection. I see other improvements as needing to be there all the time, especially paid sick leave, so people aren't coming to work sick and infecting others, and improvements in indoor air quality. So I think, we've been given our homework, but we can't procrastinate until the eve before the next pandemic to put it all in place sustainably.
Monica, Thomas mentioned some of the measures that we had at the height of this, and some of those measures have been relaxed. And the temporary paid sick days program expired on March 31st, 2023. what does that mean for managing workplace spread of viral infections? Because if you're an employee and you get sick, you can no longer rely on that.
Yeah, so that was a program called the Workers' Income Protection Benefit that was put in place. And in the end, it was something. It wasn't an adequate program. It was 3 COVID-specific days, now over 700 days. So you only had those 3 days, and now that program is finished. So essentially, employees are guaranteed through provincial legislation 0 paid sick days. And as you said, one of the biggest lessons we've learned is people need to be able to stay home when they're sick to protect themselves, their coworkers, their communities, and people no longer have that. So absolutely, some provinces and the federal government have learned and have put in place legislated paid sick days, meaning every employee has a right to paid sick days, whether you have an infection, whether you need to take your child to go get vaccinated, whether you have a broken ankle, you need to be able to stay home when you're unwell, and that should be a lesson and a right that every employee should have.
I think one of the things that a lot of us became familiar with during this was wastewater and how it can help to show us where there may be where COVID is really high. And critics say that there's very little value in finding and funding wastewater testing and other preventative measures, given that Ontario is so-called quote, back to normal, and probably won't mandate public health measures again. Farhad, why do you think we still need that?
Yeah, this is such a prime example of not taking the best learnings of this pandemic and sustaining them. Wastewater technology was something that we theoretically talked about pre-pandemic, and suddenly we realized in this pandemic, and a lot of it was Canadian innovation, that this incredibly useful technology could give us information about community spread passively. So you don't have to go line up at a testing center and get a PCR test done. You don't have to report a home rapid test that you take. You have this ability to passively measure where spread is occurring. It can be done at the level of an institution. It could capture explosive outbreaks in long-term care or in a school setting. It can tell you about a community. It can tell you about things that are not COVID. It was important, for example, in detecting polio outbreaks that were starting in the United States. It can be used for RSV. So this is an incredibly important technology, and this is part of the sustained response that I'd like to see in place. This is an early warning system. This is a monitoring parameter. It's part of having society have the information it needs to make those smart decisions. After SARS-1, we committed to saying that we would do those things. After SARS-2, I hope we will actually do those things, and wastewater is part of it.
And Thomas, I wanted to go back to vaccines because the Ontario government has said that one of the reasons why they're relaxing a lot of the measures, or why a lot of the measures have been relaxed, is that Ontarians have led the way in getting vaccinated. But right now we're at 18.6%, which is a far cry from the high uptake we had before. At the beginning, I think we were under the impression that 2 vaccines was sufficient. Then we learned that you needed to have more, and then the boosters. So I'm trying to figure out, like, how do you turn that around? How do you re-communicate to people that it is important to stay up on getting their vaccinations?
Yeah, I mean, I think that, again, slow and steady approach needs to involve continued upkeep with vaccination protection. Part of that complacency, again, is a function of the vaccines having done their job and continuing to provide protection against severe disease. Part of it is the evolving nature of science in the pandemic. You know, there was parts of our response to this pandemic that we were building the plane while we were flying it. We knew when vaccines came out that they were safe, but we didn't know how long they'd be safe for. We couldn't have predicted the Greek alphabet of variants that continued to change the dynamic of vaccine protection as the pandemic unfolded, and as a result, there is not as much prevention against transmission, which is what people, I think, really want to see and have the benefit from. Now, there's future technology that may come that may, again, provide better prevention against transmission, and that will be excellent. But in the absence of that, we really need continued vaccination to protect people, especially against severe disease, especially those at higher risk of severe disease. Those are the populations we continue to message and emphasize need to keep up to date on vaccines. So in my region, it's sitting around 21% of people that have had a dose in the last 6 months. Many of those will be those at higher risk. I didn't get a spring dose of the bivalent myself, but I got a fall dose, and I'll be ready to roll up my sleeve again next time NACI says that we need to be getting a dose to protect ourselves, which may be this fall or maybe further into the future.
Fahad, Thomas said something that I thought was super interesting when it came to vaccines. You said that we were building the plane while we were trying to learn how to fly it. NACI is now recommending the next round of boosters to people in high-risk communities. Should there be a push for everyone to get the next round?
No, I think the NACI recommendations are actually quite science-based. So they are prioritizing now people who are at highest risk of severe disease. So, as Thomas said, when these vaccines were developed, the hope is that you would have sustained protection against infection and severe disease. But the most important thing is severe disease, and these vaccines have remained remarkably effective at preventing severe disease in high-risk groups. And so the NACI recommendation is about recognizing that for most people, for you and me, we've had our rounds of vaccines, we've had infections, an additional dose right now is probably not science-based. It could be in the fall, but right now it's not science-based. But if you're over the age of 80, if you're in a long-term care setting, if you're immunocompromised, there's very clear evidence today that going out and getting vaccinated with a repeated booster could prevent what we most care about, which is severe disease, ending up in hospital or dying. And that's the group that I worry about the most. So if you look at the overall Canadian statistics, and Ontario matches this, among older individuals, this is the very high-risk group. The uptake of that booster within the last 6 months, probably at least 50% of people have not received it in that very high-risk group.
That's worrying.
And that's the messaging gap. So do you and I need it? Does someone who's 30 and healthy otherwise need it? Probably not right now. But if you're a high-risk individual and you're in that 50% group who have not been vaccinated, why not? Where is the messaging gap?
On the other end of it, because I have 2 kids, and in the past 3 years, they've had no immunizations at all. Childhood immunization against viruses like the flu took a dive during the pandemic. So, Monica, explain to us, what are the implications of that?
So the implications are quite worrying. We're seeing even globally, and now from the pandemic, we know how connected we are. There are at least 25 million children who are unvaccinated or under-vaccinated against measles, for example. So that has an impact on us. We're seeing large outbreaks in the US and in Canada and Ontario. Definitely there was a significant decrease in all childhood and school-aged vaccinations, and public health and primary care providers are working incredibly hard to try to get that back up. But we do need to have high levels of vaccination coverage to prevent the illness, hospitalizations, and deaths from infections that we largely have not been seeing in Canada, but there is a risk now that we may start to see them. So definitely, it does speak to also needing that robust public health workforce and primary care workforce. These are nurse practitioners, physicians, nurses, others to be able to get us back to where we need to be.
And Thomas, public health units are calling on the provincial government to provide more sufficient, predictable, and timely funding. Can you tell us about the funding formula you're working with now and why it's not sufficient?
Well, it's a real challenge. I mean, through the pandemic, we effectively had to redeploy 80 to 100% of our staff at different times to respond to COVID, and we had to hire and surge in many more staff to help support. And my thanks to the incredible work that those staff have done and suffered significant burnout through the pandemic as a result. But that's all coming because we weren't ready. We did not have a public health system that had the buffer space, the buffer room to be ready to respond. And what it's been like with, again, like the Chief Medical Officer of Health report this year says, this boom and bust cycle of public health funding, I would equate to if we had a local fire department that after a big fire, the fire's done responding to, we lay everyone off, we cancel all the services, and then we're surprised, a couple years later when another big fire comes and we're not ready to respond. And this is the challenge that we've perpetually faced in public health for my whole career. Again, I mentioned this is my 5th pandemic in my short career so far. We're going to continue to need resources to sustainably respond, and we don't even have the resources to do our base function and work. People may not know this, but it's been over a decade that we've effectively had 0 increases, 1 or 2% in a couple of years, but no increases to our base budget. And with staff salaries and inflation increasing 2 to sometimes 5-6% per year, that means over the last even decade, shrinking services. Every year, we have less ability to even do the base function that we need. And so there's a massive gap in what we need from a funding standpoint. But when you compare to other sectors, it's not actually a lot of money because public health is a very small piece of the government pie and puzzle. And so I think some modest investments in public health now will help to create sustainable response readiness into the future and also save money. I think one of the other lessons learned of the pandemic was in Canada, we did not have adequate personal protective equipment stockpile. We did not have in-country vaccination production capacity. And as a result of those, elements of not being ready, it actually meant that we had to spend a lot more money on those things than had we spent a little bit slow and steady to kind of win the race longer term. And that's what I think public health units are advocating for now. And I know into next budget year, there are significant uncertainties. The provincial government changed the funding formula. There's been a download onto municipalities, but more than that, we haven't even had the stable funding and increases that we need just to provide our core services. So this is the challenge in public health. We, I think, do Lion's work with a mouse's budget, but it's not enough. And I think the public needs to demand more from government so that we don't find ourselves in the same position again.
Well, we did reach out to the Ministry of Health asking them to respond to claims that the new sharing formula implemented in 2019 and mitigation funding are insufficient. Here's what they said. There are no plans to change the cost-sharing ratios, and our government will continue to invest in public health. The dollar amount that flows to public health units reflects a 75-25 cost-sharing ratio. Thomas, I wanted to get your reaction to that, but I wanted to go to something that you just said. You said this is the fifth pandemic that you've been through, and we've all, I think the past few years impacted every single person in this province. And you said that you're just asking for modest funding. One, I wanted to get your reaction from what the ministry said, but I wanted to also ask you, are you surprised or are you frustrated that considering the past 3 years that we've been gone through and all the lessons that we learned, that this is where we are right now?
I think I'm neither surprised nor frustrated. I think if I was frustrated, I wouldn't be able to keep doing the daily job that I do. And my staff, our team is incredible, and the work that public health does is incredible, and it inspires me every day to negate that frustration. I've been through this. I've seen this again. But in 2003, the SARS-1 pandemic and the Naylor report quote that I shared earlier, there were 44 Canadians that died. 44 Canadians. And in SARS-CoV-2, COVID-19 to date, we've had over 52,000 Canadians that have lost their lives. So the magnitude is so much different this time. I think if we truly do not learn our lessons this time, yes, I will get increasingly frustrated, and I think the public should too. This has been a once in a generation, once in a century pandemic, and it behooves us to do more to prepare ourselves and have a public health system that is capable of protecting Canadians.
We only have a few minutes left, and I want to get a few more questions in. Monica, you've held medical officer of health positions in 4 provinces, including Ontario. Why is it so important that public health units have the funding that they need?
I think echoing Thomas, if you look at how little public health has been funded in any province, it's been about 1 to 7% of the overall healthcare budget for the part of health that is intended to prevent people from getting sick in the first place. So if we invested in prevention sufficiently, it would help people to live longer, healthier lives. And so by not investing in that properly, I think we are showing our priorities, that we're not looking at, say, those inequities of why some people in some groups, those who are more marginalized, tend to have poorer health than other groups. We're not trying to address why that happens in the first place, which is what public health tries to do, in addition to these types of emergency responses. So I think the sad thing is that we continue to have these discussions about needing to invest in public health, but as we see now, as attention starts to fade, those windows of opportunity are, I think, becoming smaller, but we still have an opportunity now to truly invest in public health.
And Fahad, many COVID, cold, and flu clinics across Ontario recently closed as their funding expired on March 31st. Is this the right time for them to be shutting down?
I think it's reasonable for them to shut down into the summer months where respiratory virus season has started to wane. They are an important part of the response, though. So look, Canada entered and Ontario entered the pandemic with one of the lowest per capita acute care capacity of any comparable wealthy nation. That was the baseline availability of resource when we went into the pandemic. We have not improved that significantly. That is a generational investment. That will be something that we can improve over the next 10 or 20 years. So we are going to enter this fall season, 2023, with the same baseline low capacity. These clinics are really important to offload hospitals and emergency rooms, which are where a lot of the constraints happen. So last year we saw a record number of emergency room closures. We saw record wait times within emergency rooms to get admitted to hospital. These clinics are designed to offload some of the pressures that exist within the emergency rooms within hospitals. So they're a very important part of the response and should be sustained until we have time to build that long-term capacity, which, as I said, is important, but is still many years away. Mm-hmm. And I'll just go back to what Thomas and Monica said about public health. COVID is one of the 5 most common causes of death for Canadians currently today, but public health gets less than 2% of funding of total healthcare funding. So there's clearly a mismatch in how we are spending healthcare dollars relative to what is actually killing Canadians. And this is where the big opportunity, I think, is. So public health being strengthened so that it can deal with the vaccinations, the preventions, the upstream effect, the social determinants, the spread inequity, the fact that it's predominantly older individuals and racialized groups that are being affected now. There's a really important opportunity there, and I think we have to use numbers to guide that decision. And if you did, you would spend more on public health.
And also, we know that COVID-19 restrictions in long-term care homes also ended on March 31st. Staff is no longer being tested, caregivers or visitors who don't show symptoms of COVID-19. They're also not doing daily temperature checks or screening residents returning from off-site visits, physical distancing, or keeping the limit of one caregiver during an outbreak. Thomas, when you consider all the changes that have happened, how has the province improved its response against COVID-19 and other viral infections moving forward?
Well, I think we have learned a lot, and we'll be able to re-escalate as needed into the future. And I think, again, using the driving metaphor, we need to be able to put our snow tires on when the snow's out, but we also need to make the road safer all the time. So what are the background things, like improvements in indoor air quality, investments that we can do that will, in the background, without needing to wear that mask, actually help to make things safer over the longer term? Those are the questions I think we really critically need to be asking now. And then beyond that, I think the public has a right to clarity in the current risk and context. Here in Peterborough, we have a Peterborough Public Health COVID-19 Risk Index. Similar to an air quality and health risk index, it on a weekly basis is updated, and this week it's low. I think we need to be proportional and honest about the current risk, and as it escalates, which for COVID has not been seasonal yet, has actually been more on an every 3-month basis, the public has a right to know that. We've done this for air quality for a long time. In fact, right before we were starting the interview, I got a weather app alert on my phone saying the air quality is a problem out there now. Why aren't we doing this, in a coordinated manner for COVID-19 into the future? We have the wastewater data and other data sources to inform it. I think in the least, as people make individual risk decisions, which is the point we're at in the pandemic, people need the best information to do that.
A big thank you to all of you for taking time to speak to us. Again, your schedules are incredibly busy, and we do appreciate you helping us understand this better. Thank you so much.
Thank you.
Good to be back.
Thanks for the chance.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.